Next, please. Hi.
Hi,
What can I
good
do for you
morning.
today?
I'm finding life a bit anxious making just now. I'm working full time, my husband's abroad,
Okay.
my child's just left to go to university and I'm doing an online course, and I really feel as if everything's getting on top of me, and I felt like this once before, about 3 or 4 years ago. You'll have it in your records, and you gave me some tablets, and
Yep.
that just helped me just get over the hump, and I'm really thinking that I need some medication.
Okay. Let's see your records. Would that be... Sorry. 2 years ago, roughly?
Yes, that would be about right, yes.
And do you remember the name of your tablets you got there?
Valium?
Let's see. Yeah, you got 20 tablets at that point.
Yes. Yes, and that was enough. I didn't need any more than that. It just helped me get over the hump. I'm feeling tearful, and I don't feel able to get moving, motivated, and things are slipping, and I'm just a bit down and
Yep.
anxious. I just feel anxious.
But you're working now, is that right?
Yes, I'm working now.
Yeah. Is that okay?
Yeah, everything's fine at work. Yeah, no, it's great. I enjoy it, but obviously it's because I'm feeling a bit anxious. I feel as if things are getting on top of me at work a little bit, but it's not really. I know that it's not. It's just the way I'm feeling.
Okay. Are you sleeping well?
I wake up early in the morning, and I don't seem to be able to get back to sleep. I go to sleep okay at night, but I wake up early in the morning and I don't seem to be able to get back to sleep very quickly.
Okay. You eating fine? Concentration's good. Memory's good.
Concentration could be a bit better. My memory, I'm getting older, you know, my memory just goes a little bit. But other than that, no, I'm really just feeling I'm worried about things. I'm worried about my daughter. She's left home, and I'm worried about all of that. And my husband's abroad, and this online course is driving me insane. But I know that when I'm on form and when I'm not just feeling so overburdened, I'm fine.
Is that why you're not looking after yourself as well at the moment?
I am looking after myself. I'm eating quite healthily. I just struggle to get to sleep. I sleep okay at night. I wake up in the morning.
Okay.
My mind's going nuts. 4 o'clock in the morning.
Any alcohol?
I have a couple of glasses of wine at night. Just helps me get off to sleep.
With glasses, how much do you mean?
Maybe about 200 mils in a glass. That would be reasonably smallish glasses.
Yeah, 2 of those?
Yeah.
Okay. And you wanting tablets?
Yes. That helped me the last time, and that's what I want.
Okay. We need to follow our guidelines and recommendations. We've just had recently updated guidelines. We use things like NICE guidelines and stuff. And you describing anxiety symptoms that seem to be related to specific issues. And we don't think tablets are the best thing anymore. There's much more recommendations. A big, talking with professionals, having what we call CBT, cognitive behavioural therapy, working through these issues is probably a better long-term option.
Okay.
And is what is firstly recommended and second recommendation. We try and avoid, especially those types of drugs you're talking about, Valium, because we know they just make you addicted to them.
So what about this? Did you say cognitive CBT?
CBT.
What does that mean?
It's a psychologist who will talk to you about how things you do can affect.
How long does it take?
Well, it's usually hour sessions, session of an hour. If you're lucky, once a week, that'd be quite good.
I don't have time to do hour-long sessions once a week. I'm working full-time and I'm doing an online course, and I've still got a house to manage. I just would prefer... The tablets worked for me before. I would prefer that I got them.
You don't have any of them left yet, still? You finished all the ones you had?
2 years ago, yes.
Yeah, so you took all of them in one then?
When I needed them, yeah. And that was fine. That was all I needed, though. You gave me, I think, 20 tablets. That was all I needed, just to get me over the hump.
Yeah.
Just about 3 or 4 weeks.
I still think it would be worth having a more in-depth discussion about this to see what would be your best options. Because there are other tablets as well that can be used. Right. But again, they're more preventative. It's more to keep these things going so it doesn't happen again and again and again.
Right.
And also ways of coping with stress.
How long is it if you get referred for CBT, how long does it take to be seen?
Depends a bit on different areas. Where is it? You live just locally here, don't
Yes.
you? Yeah. I would have to send a letter and we would get a reply to tell us how long you'd have to wait. And I would hope it wouldn't be too long because this is one of our prioritised areas. And
How long's too long?
well, it should be within a month, I would hope.
A month?
Yeah.
I could get tablets and be fixed in a month.
Yeah.
So you're saying I can't get tablets?
Well, I definitely wouldn't give you that many, and I really think it'd be worth looking at the other options. How about I gave you just a few, like a couple, to see if that does you in a little bit, and
then I have to come back when I'm finished then and go through this whole conversation again.
No, I think we should refer you straight away.
Right, so no tablets. You've gone from I'll give you a few tablets.
I'll give you a few tablets and we'll refer you, because that means you don't have to come back here unless there's a problem.
But you're saying the referral's going to take a month and you're going to give me a few tablets. I'll be back here next week seeing, can I have some more tablets then?
Do you think it's going to last that long? Because if it's going to last that long...
Well, you gave me 20 tablets the last time and it took the 20 tablets to help me get myself sorted out. So yes, I do. I just think this is ridiculous. Changes, I'm all for changes, but it worked. What if it works? Why?
Oh, it's just we know the damage they can do. Affect your driving, affect everything.
Addicted. It just was a short burst. It was one. But I suppose if that's your guidelines, then.
Well, I think that'd be in between. We can give you a couple of tablets now to try for the next few days. I'll send a referral today, and obviously, if you feel it's not better, you can come back. But I would hope you wouldn't need to.
Well, I suppose
can I
have
just
to do.
check here as well? The computer's reminding me that you overdue your smear as well. So that'd be
really?
worthwhile. Yep. We have targets we need to reach.
Targets?
Yeah, so it's worth getting them done.
But are you sure your records are right? I'm pretty sure I had my smear less than a year ago.
Was that somewhere else then? Because that might not be recorded here.
No,
Did you go
it
somewhere
was
else?
here. This is my practice. This is
Let's
where I
see.
go. You're going to ask me about my blood pressure next, aren't you?
That was done. We need to do that every 3 or 5 years. I've got that. So
You've got
that's
that.
been done. That's okay. But the smear, it's not been recorded here. Did you get a letter with the result? If you
I
do,
can't remember.
we could record it that way. It's
Okay.
not going to do any harm getting an extra one. So make an appointment with the nurse.
Right.
The time that suits you, and we'll get that
Okay.
done as well. So then everything's
Okay.
up to date.
Okay.
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 I'll just write the prescription.
Okay. Thank you.
That's it. Okay.
Thank you.
See you.
Bye bye.
Bye.